Good afternoon, everyone. Thanks so much for joining us here at your lunchtime. My name is Alexander Cooley. I'm the current director of the Harriman Institute, and it is a great pleasure to welcome you to today's lunchtime event, virtual event, Russia in the Time of COVID-19. This is part of our Russia Public Policy series that we run in conjunction with NYU's Jordan Center. And I just want to acknowledge and welcome my partner, Josh Tucker, who will be co-chairing the panel today. For those of you who have been with us over the last few years, this is a series that we are now in our fourth year of doing, or approaching our fourth year, which tries to identify important issues that are going on in Russia and encourages a cross-professional dialogue involving both academics, policymakers, professional observers, to produce what we hope are lively and engaging, informative events. So we've taken the RPP, virtually. I'll mention some additional events later, but today's panel really features 5 extremely distinguished and knowledgeable guests who represent the fields of academia, both political scientists and anthropologists who are interested in public health, as well as journalists in Moscow who have been looking at the evolution of how COVID has played out and governmental response. So the way we're going to proceed today is I'm going to turn things over to my partner, Josh, who will introduce the panelists. They will each offer presentations, and then we'll invite you, audience members, if you have questions, please use the chat function on the Zoom, and we'll try and select them and bundle them and address as many questions as you like. But again, thanks so much for joining us today. Welcome to the panelists, and Josh, I'll let you take it away from here. Oh, and thanks again to Carnegie Corporation of New York, whose generous support allows things like this to go on, even while we're social distancing. Josh?
Great, thanks, Alex. And let me just add, on behalf of the NYU's Jordan Center for the Advanced Study of Russia, how happy I am to see all of you here today. We tried to schedule this so we could have, breakfast on the West Coast, lunch on the East Coast, and dinner or post-dinner drink in Moscow or pre-dinner drink maybe in Moscow today. So it's great to see so many of you here today. We're absolutely thrilled to have the New York City Russia Public Policy Series back up and going virtual. And one thing we decided is that since we're no one's really going anywhere, we normally end these things at the end of the semester because we don't have people around campus. But since we've brought it back up, we're going to be running this through, in the coming months. We've got a number of events planned, which Alex will talk about at the end. But we're going to keep doing this through, so the end of the semester is not really going to matter. We're going to go into the summer, and we'll hope you'll join us for more events in the New York City Russia Public Policy Series going forward. So anyway, it's my great pleasure to introduce the panelists. Because we're in the virtual format, I think I'm going to just introduce each panelist as they speak. And the goal is to have each panelist speak for about 10 minutes, which will then give us about an hour for discussion afterwards. And I hope you're as excited as I am to hear what all of them have to say. So we're going to kick it off. We're going to ask Dr. Gulnaz Sharafutdinova, who is a reader at King's College in London and an affiliate of the King's Russia Institute. She studies comparative politics and political economy with a focus on Russia. Her forthcoming book, The Red Mirror, at Oxford University Press, expected in 2020, inquires into Putin's leadership strategy and relies on social identity theory to explain his success. Gulnaz is currently writing a book called The Afterlife of the Soviet Man, Rethinking Homo Sovieticus, that explores the intellectual biography of the term Homo Sovieticus. She's also, and I got to say, I once was trying to look that up online and figure out where that exactly came from, so I'm very much excited about this book. She's also researching the regional variation in response to the COVID-19 pandemic in Russia, and she's going to kick off our discussion today on Russia in the time of COVID-19. Gulnaz?
Thank you, Josh. Thank you, Alex. Thanks for organizing this, and thank you for all our audience for joining us here. So I'll start out maybe with 4 major points in my opening remarks and leaving a lot of meat, hopefully, for the Q&A period. I think it wouldn't be a surprise to hear that the pandemic found Russia at a very delicate, at a very fragile moment. And the fragility is both economic and political. The oil crisis have collapsed at a certain point to almost negative ones, now have gone a little up, but being the major source for the Russian budget, Russia's economy is in deep trouble. And we all know that. But besides that, Russian political elites have been trying to organize power transition. And from January and to early March, we all were witnessed the opening of the plans in some way for the government, for the autocrats who are very much want to control information. A lot of their plans were exposed and counterbalanced by the pandemic, by the health crisis, which basically opens up issues as to what to do. The plans about the referendum over the constitutional amendments had to be scrapped. They couldn't happen on April 22nd, but this issue is still hanging out there and needs resolution. You might have noticed Zhirinovsky 2 days ago called for just abolishing the referendum altogether, suggesting such plan to the Kremlin. I don't think the Kremlin took it seriously, and there seems to be still an intention to have the referendum, and the yesterday's bill allowing for the online voting and for the mailed voting seems to be one step towards that resolution. So this issue was left hanging out without the final point, without the resolution, and it's still out there. Now, my second point is that early on, Russia observers did notice that Putin was absent in the early days of response to pandemic, giving on the one hand opportunity, but also responsibility to Sergei Sobyanin, mayor of Moscow, who had to take the brunt, go to the forefront of the response, but also through the more formal devolution of policy making to the regional governors. For a couple of days, I think the Kremlin felt the brunt of Putin's loss of the media centrality, from the media centrality for Putin. And there was a very quick response from the presidential administration of bringing Putin back onto the media stage and putting him central to governing the response to pandemic crisis. To a certain extent, early on in the first weeks of April, that strategy did work to bring Putin's approval ratings up. So public did react favorably to that quick response. But I think it's also important to remember that it is hard for Putin as a leader who made his name and recognition based on foreign policy issues, based on Russia's international standing and international status and collective and national identity issues, to quickly switch his quote-unquote expertise to domestic issues, day-to-day governance. And that hasn't been his forte. And maybe therefore it's not surprising. We do see that Levada opinion polls at least showed that by late April, opinion polls were showing his popularity rating dropping to pretty minimal levels, to 59 or so. And very interesting response, while the governors were seen as potential blame takers for restrictive response to the pandemic, the governors' rating have been, for the first time in Putin's presidency, were higher, a few points higher than Putin's approval level. And of course, it's average numbers across Russian regions, across all of Russia, but the latest numbers were around 61% approval ratings to regional governors on average, with around 59 for Putin. So we see this interesting political dynamic that has been accumulating over the past month or so. Another important issue to note is, what do we learn, what can we expect based on Russia's early response to crisis, right? What type of crisis Russia has gone through and what is the history there? Has Russian government been very effective in responding to crisis? Now, if we think in terms of health issues and health crisis, I think there is one very negative example, and that is HIV crisis, HIV epidemics, where Russian government hasn't for a long time been able to contain the epidemic. In fact, was in denial over it. So that's not quite a good history. Then we have a series of terrorist acts, which are also, you know, public affair crisis tragedies, where the Russian government also hasn't shown itself very effective. When we remember Beslan or Dubrovka, where there were loss of many lives, etc. So, you know, despite the fact that the early talk about authoritarian advantage on containing crisis, for example, in China, etc., Russia hasn't shown itself over the last crisis as a very effective thing. There is one exception. There is a work by Lazarev, you might remember, that looked at trials by fire, where response to fires in 2010 were actually worked to increase public approval ratings to authorities who could show their performance over that crisis. So I think that's something interesting to also think about. Now, with regard to pandemic, as I mentioned, the important element of the response was to shift decision-making to the regional level. To my sense, it has been a very adequate response given the vast territory and extreme inequality and unevenness of Russian regions. So no recipe, no cookie cutter approach works. That's for clear. So there is an adequacy to that strategy, although there is also the misfit between how the power vertical was organized as a centrally top-down controlled system of power, now shifting the policymaking responsibility to the regions has been, in a way, this decentralization direction that contradicted to the earlier centralization direction. But there is also, besides the adequacy of the response given the territory, there is, of course, the political logic that for the Kremlin, this is gives a potential ability to shift the blame away, to exchange governors, to basically keep them as scapegoats for things that go wrong. The opinion dynamics, I think, takes a little bit away from that potential political strategy. As I mentioned, the governors have seen a certain degree of rise of support among the public, and I think just removing the governors in that type of situation might not be a very easy thing to do either. My last point is about the great variance among the regions in Russia and the variable capacity level that the governors have to respond to crisis, but also the various degrees of vulnerabilities that regions have with regard to the spread of the virus. We have, of course, a case of the epicenter, Moscow, which follows, again, the dynamics of many other countries where the biggest urban territories become the center of the pandemic. Moscow's GRP, I just checked, is compared to a very rich country of Qatar, above Luxembourg, GRP per capita. So we're dealing with a very rich city which has a lot of resources at its disposal to construct hospitals, to give out money. The same with Yamal-Nenetsk or Khanty-Mansi, the gas producers. And we do see in those regions, the governor in Yamal-Nenetsk, Dmitry Artyukhov, in contrast to all the central government decisions and to other governors, he was using the helicopter money approach. He was giving out money to self-employed, to small businesses, etc. But he did have that money. Now, if we look at the Caucasus, another emerging epicenter of pandemic, that region, you know, as a whole, Dagestan in particular, but also Ingushetia and Chechnya, they are one of the poorest economies with a lot of informal, with a big informal sector and very weak healthcare sector. So the capacity to respond in that in these regions has been very different, and so we see you know, the magnitude of the crisis developing much, much higher. My last point is with regard to the signals from the center that come to the regional governors. I think the vertical of power was constructed in such a way as to send signals to governors who are supposed to respond to those signals, thus catering to the interests of the Kremlin, of the federal center. And the replacement and of many governors over the last few years has evolved in that direction. A lot of technocratic governors, many of whom look alike. I refer sometimes to them as Agent Smith, if you remember from Matrix. I mean, they look alike, they have similar names. Sometimes it's really, really hard to distinguish between Gleb Nikitin and Andrei Nikitin and Dmitry Azarov. They wear similar glasses. They're, you know, I don't want to exaggerate, but some cases are quite amazing. So these governors were put into place to read those signals. And at this point, the signals, I think the clearest signals that they are getting from the center is that they will be held responsible for both the spread of the virus and for the containment, but also for the economic conditions and for the economic stagnation in the region. So they are threading very difficult situation, you know, between, you know, two hard lines between Scylla and Charybdis, and they have to decide what to do. And unfortunately, I think in this impossible situation, and I'm sure we'll talk a lot about today, they go to the data management situation. And I'm sure we'll talk a lot about the data and how that is produced and how that also reflects the signals that governors receive from the center. I'll stop at that. Thank you.
Fantastic. Thanks, Gulnaz. All right, so our next speaker will be Professor Regina Smyth, who is a professor of political science at the University of Indiana, Bloomington. Her research explores the relationship between democratic development and electoral competition by focusing on candidates, political parties, and party systems in post-communist states. Her book, Candidate Strategies in Electoral Competition in the Russian Federation, Democracy Without Foundation, which was published by Cambridge University Press, explains the failure of Russian democracy in terms of the factors that impeded cooperation among candidates and party leaders and failed to produce a viable opposition to the ruling party. Her current work on party and party system consolidation across the post-communist states examines the processes that produce congruence between key political alignments or power centers and partisan competition. Regina?
Thanks, Josh. I'm good, you can hear me. So here's the, my more recent work has focused on urban activism and processes of collective action, both in elections and in protest. And this is the relationship or the work I'm talking from today. And I just want to plug my forthcoming book at Cambridge Press in November, Elections, Protest, and Non-Democratic Regime Stability. Russia 2008 to 2020. Okay, so here I want to pick up where Gulnaz left off and talk about a project that we've been developing together that looks at the regional aspects of this crisis. And we're thinking that Evan's wonderful article about Putin aside, recent article, that the mechanisms of regime stability are emerging as a regional story, that the control over the state narrative, the capacity to shift blame, and the potential for mobilization is emerging on regional levels, not on national levels. And that accounting for the variation, as Gulnaz pointed out, across regions, depending on the spread of the virus, the response, and the economic costs, will really shape the regional elements of this crisis and social mobilization. And here, I don't want anyone to hear me predicting revolution, but what I am going to marginally predict is the idea that we're seeing both the revelation of new social capacity to make demands on the state, but also the accumulation of social capacity in response to the crisis. So let me just very, very briefly give you some context. So this doesn't come out of nowhere, this response to COVID on the regional or on the individual level, that we've been observing a profound change in the relationship between state and society over time, particularly in urban areas, but not only in urban areas. There are important linkages between the urban and the rural. And And also these state projects, which of which healthcare has been an important part, began in 2004. So there's a background in which the society might have expectations about the states. In 2018, the optimization program looked a lot like an unfunded mandate out of the May decrees, where power for healthcare shifts to the regions, but without adequate funding. Optimization itself, as you know, led to significant social protest, particularly among doctors and healthcare workers, but also in middle-sized cities where we see significant frustration with officials over healthcare issues. So the pension reform was seen as a betrayal of trust that eroded trust in the system. There's been growing labor unrest across Russia that we see in the statistics, and the work I've been doing on non-political, and we can talk about what that means in a second, protest or urban activism, online, offline, the linkages between the two, and the transformation of this non-political protest, like trash, against trash incineration, towards more political activities such as mobilization around Navalny. Those things are starting to change, not only in Moscow, which is how we like to talk about it, but there's wonderful work by young scholars showing that it's also happening in other places. The last thing I want to talk about, or just the context I want to give out here, is that we see also in the context of past state events, we see a shift in state strategy. So the state has been building its capacity to co-op mobilization, grassroots mobilization, to partner with grassroots mobilization, and then to discredit it. So against that backdrop, which is probably a little too long, let's think about what we might see. So what shapes mobilization in Russia? When you look at the emergence of grassroots mobilization, I see four important factors. The first is intervention in everyday life. So when everyday life is disrupted, when you see state interference, you're more likely to have mobilization. When there's a gap between promise and action, when there's a promise of policy and it's implemented poorly, you're more likely to see mobilization. And the direction of that mobilization depends on who is trusted. And this is why it's so important that the trust in regional governors has been rising over time. The last factor that we see a lot is emotion. So in 2011, 2012, we saw a constant reference to dignity, that people had been betrayed by their state, that the state action revealed them to have been duped. And there is a real response, and we see similar work on emotion in lots of studies of mobilization. Anger prompts mobilization, fear depresses mobilization. And so this movement from the COVID crisis, the public health crisis of fear, to the economic crisis of anger is a place where you might start to see mobilization. Right? So, okay, I think that we are seeing four significant gaps in the narrative start to play out in Russia. That is not an entire loss of state control over the narrative, but is challenging the state narrative. So the first is the crisis gap itself. Gulnaz talked about the statistics, who is ill, how many people are ill, who has died. I'm sure we'll talk about that. But there are two parallel discussions happening. There's the state discussion of numbers and what is happening, and there's this fascinating discussion of what is happening to doctors. And to my mind, the doctors are serving as a proxy to tell us how extensive the virus is, where the hotspots are. And we're seeing all sorts of really creative protests or demonstrations, symbolic acts to let society know about the cost of this virus. From the list of remembrance that's being published, which has an incredible number of Dagestani doctors on it, underscoring to us that Dagestan is a hotspot. We're seeing memorials in St. Petersburg set up to recognize doctors who have died. And we're seeing coverage in regional press, quite extensive coverage of regional press of doctors' protests, including in Omsk recently, where there was a large protest of doctors unable to be tested despite the work they were doing. The second gap is the economic gap. We see a lot of demand for attention to micro industry, private, small, and medium-sized industry. Business associations are mobilized to press these demands. And despite the sort of idea of paid holidays, people are not being paid. And there is starting to be a discussion of whether or not this is a new mechanism of economic centralization, right? Are you being schooled in the fact that private industry is dangerous? And we are seeing significant protests emerge to reopen in order to protect livelihoods. The third is the sort of disappointment gap in the state report. So there's a lot of discussion of where are the benefits. Putin is saying, look to your governors, look to your governors. That strategy for the moment is not working uniformly, and paying attention to where and how it's working is important. We're also seeing a very interesting flip of the script where Putin's emphasis on Russia's international position is now being co-opted by opposition, most notably Navalny, but there's a discussion where there's a discussion of why are we sending material abroad, but also why is the rainy day fund not being used to promote and be given out. And here the discussion centers around Americans got this much, Italians got this much, where is our support? So there's a very interesting flipping of the script. And against that background, you see very significant online mobilization. It varies widely by issue, by the relationship to the state, whether it's co-opted, whether it's partnership. We see United Russia being organized to give out food to elderly people in some regions. In other regions, this is a grassroots action. It's a very different kind of response. So we are seeing reflected lessons learned from grassroots mobilization in the past. So I would say against this spectrum, we are likely to see, as the pandemic slows and the economic crisis deepens, more online protests demanding state response. And we need to be prepared to think about where that will emerge and in what regions it will be most threatening to the central regime, where it will be most damaging. And the last point I want to make is that we can expect, as Gulnaz already said, not a one-size-fits-all response to mobilization. So we're already seeing in some regions labor unrest is bought off or quickly mollified. In other regions, we're seeing much more confrontational situations. And I think these are sort of the parameters of what's happening, and we can get into the weeds of the discussion in the Q&A. Thanks.
Wonderful, 10 minutes on the nose. I was just about to hit 0 minutes left, so perfect, Regina. Thanks so much. Really illuminating. Our next speaker is Svetlana Borodina. Svetlana is a PhD student in anthropology at Rice University, who I'm very pleased to announce will be joining the Harriman Institute this fall as a postdoctoral fellow, and hopefully that means we'll be seeing more of her in New York, but certainly we'll be seeing more of her virtually until then. In her current dissertation research, she focuses on the dynamic relations between blindness and disability and the ways in which these categories factor into the production of the category of the human in post-Soviet Russia. Specifically, she ethnographically and historically investigates the ways in which blind people themselves, state policies, caregivers, accessible prosthetic technologies, urban environments, and disability activists for the past 30 years have been collaborating to redefine blindness as a resource rather than a lack. So we're very excited to have someone who has been working as an anthropologist in the public health sphere to give the sort of anthropological perspective on Russia in the time of COVID-19. Svetlana?
Perfect. Thank you, Josh, so much for a wonderful introduction. And thanks everyone, organizers, panelists, and our audience today. I'm excited to be here. And so my approach here will be slightly different because my academic background is in, as Josh mentioned, in cultural anthropology and not political science. So I pay attention to slightly different things. And it's very interesting to see different kind of resonances between the approaches that different panelists take. And as a discipline, just to give you a brief explanation, cultural anthropology examines peoples as products and makers of broader systems in which they live. And here I mean ideological systems, material environments, socioeconomic project processes, and political environments. In my research, in general, I have been looking at the development of various disability-focused programs in Russia. And during this pandemic in particular, I have been paying attention to the ways in which bodily and mental vulnerability has been constructed and experienced among various social groups. And I looked at how vulnerability actually differs group by group. And so in the interest of time, I will not provide you with a review or a detailed kind of story about how different particular group reacted or responded to this crisis, but instead I will offer a reflection of who counts as vulnerable, what vulnerable becomes in these particularly exceptional conditions, as well as what broader trends I've observed happen and develop throughout this pandemic. So it's almost become a cliche to say that that anybody is at risk for contracting the virus. Elderly people and people with pre-existing medical conditions in particular are at higher risks. Sometimes it is specified that those pre-existing conditions increase one's chances to have a more complex kind of case if these diseases are associated with the cardiovascular or respiratory or immune systems. And yet what this pandemic has shown us is that vulnerability during it is a much wider and a broader category. Because this pandemic brought about multiple crises on different kind of social planes, members of many social groups have been exposed to higher risks that threaten their quality of life and well-being. So instead of looking at how the virus threatens to kill and damage individual human bodies, social scientists have been looking at how the response to this pandemic exposed some bodies to risk more than others, and how some bodies actually gained more access to protection and support than others. And as our experience has proved, the pool of vulnerable groups is a very wide one. Among them, we can find people with complex disabilities, especially those who live in assisted living facilities, those who live in psychiatric homes or group homes, or those who depend on daily care provided by some external actors. Then people who live in rehabilitation centers, in particular those who are recovering from addiction, many of whom have HIV positive status. Then we have people of low income, victims and potential victims of domestic violence, and I'm happy to talk about this in particular too. Migrants, as well as undocumented people who find themselves in Russia without sufficient appropriate paperwork to access any support presented by the state, as well as those in detention and those who recently have been released from detention. Interestingly, we also see among other social groups among the vulnerable populations, and those are medical workers, especially those who are outsourced and are not directly hired by the state hospitals and other, as well as medical students who have been channeled and mobilized to fight at the front lines of this crisis, social workers, workers of socially oriented nonprofit organizations, and volunteers. So we see that this is a very, very diverse kind of set of groups. And we see that vulnerability here becomes extended well beyond just the boundaries and characteristics of individual bodies. From this pandemic in general, and Russia is no exception here, we learned that how much broader structures and individual positioning vis-a-vis these structures directly affects one's vulnerability. And now I wanted to briefly move on and just give a few ideas about general factors that I've seen at play that affect the position of various vulnerable populations, as well as kind of different trends that I've seen occur. It's not an exhaustive list, and it's rather more like an invitation to keep thinking and keep researching the impacts that these multiple crises have had on various different populations. So one of the first, one of the first problems that we see is that in Russia, the system of social support is request-based as opposed to being a proactive system that reaches out to potential clients and offers different services, provides a kind of a clear explanation of how they can access different sort of measures or services that they are entitled to. So which in general results to the fact that so many elderly people, many people with disabilities, homeless people, people who find themselves in a challenging situation, who have limitations in their mobility, they often cannot access those services in that system. They either physically cannot access it, or they have insufficient digital literacy to access them through now existent virtual infrastructure, how to access that. So, and this had been a problem way before, but now, especially with so many new measures being introduced, this has been a challenge among my interlocutors in the field in Russia, as well as other cases that have been reported. Another problem becomes the insufficient funding provided to the social security system. And the problem here is very complex. Not only it doesn't receive sufficient funds to support the programs that it implements, it is also severely understaffed. So there are too few social workers who may provide support and help to people who are in need, such as people with disabilities who are in their apartments, for example, and are in need of support. So that which results in the fact that a social worker can perhaps spend, I don't know, 15 minutes or a very short period of time dedicated to this one individual, which ends up in very little help delivered to the final consumer. Then their labor is poorly remunerated, which also resulted in the fact that under the conditions of the current pandemic, there's so many people who face additional challenges, women in particular, who actually also constitute the majority of social worker labor force. Those women who are not sufficiently remunerated for their labor, who bear additional burden of childcare now, and there has been a wave of people quitting these jobs, and so the number of social workers has been diminishing. And then another more or less universal problem is the insufficient provision of personal protective equipment. And here, on the one hand, to protect the worker themselves, as well as their vulnerable client. Another substantial problem has been that in Russia, many people with disabilities, as well as elderly people, live in special homes or assisted living facilities. And those that are state funded are very often cramped, and they lack proper ventilation, which result, just to give you a more kind of clear understanding, sometimes 60 people would be using one bathroom. And this becomes kind of the grounds for the spread of the virus really quickly. Again, these homes very often are understaffed, which means that it's very hard to maintain social distance, provide sufficient care, as well as contain the virus in the case if it gets into those spaces. To be fair, I have to say that several organizations who work with people with severe disabilities and complex disabilities, they have been successful in taking some of the residents of those special homes with them to take them out and to provide them care in more comfortable conditions. And I'm happy to talk about that more. Another factor that we have been observing is that structural inequality dramatically affects individual access to opportunities of protection as well as resources. So we see that those who had been already in a disadvantaged position, such as people of low income, women, people with disabilities, migrants, they suffer from this crisis the most. I have a few more I think my time is running out, but I want to also bring to the attention stigmatization of certain groups as a very important factor, because in addition to the state, various volunteer groups or businesses or other non-governmental actors have been mobilizing in order to provide support in a form of charity, in a form of social services delivered to various vulnerable groups. But we see that some of the groups receive more attention and more support than others. For example, it's known that children are a more kind of appreciated recipient of social support and health as opposed to adults, especially in the cases if those adults are connected to addiction, if they are connected to irresponsible behavior, to say. Homeless people, people with drug and alcohol addiction, people released from detention are left out of many initiatives to support other vulnerable populations. I guess another very important thing that has surfaced during this time is the produced shortage of the medication, and that would affect other vulnerable groups that have been relying on this medication and have been experiencing a lack of it. So now I'm running out of time, and just to wrap it up, I'd like to say that I'm happy to talk about very uneven effects of this multiple crisis on very different populations. It's very hard to kind of to produce a universal account, and so yes, in the Q&A session, I'm happy to talk about various groups in particular. Thank you.
Great, thank you so much, Svetlana, and I'm sure people will want to hear a lot more from you. That was harrowing, which is hard to say given how often we get depressing news about the crisis, to get new news that makes you more depressed about it. But thank you very much for sharing that information with us. Our final two panelists, I'm going to introduce both of them right now, are both are Evan Gershkovich and Pjotr Sauer, who are both reporters with at the Moscow Times. They have both been very active on social media, and in fact came to our attention through their tweeting about their reporting that they've been doing on COVID-19. Evan's reporting can also be found in the New York Times, Foreign Policy, Politico, and Coda Story, among other publications. Pjotr is a Moscow native with a Dutch background, and he previously worked in political risk consultancy and diplomacy. And they're going to kind of do a presentation together, but Evan's going to kick it off. So guys, thanks so much for being with us. Thanks for joining us. I think you're both in Moscow right now, so thanks for joining us from Moscow for this. There's a lot of things that are worse about the world we find ourselves in, where people where all of our events have had to move virtually online, but there are some advantages, and one of the advantages is that we can conduct these types of workshops with people and these panels with people from all over the world. So we're really happy. We know you're both super busy. We're really happy you could join us tonight for you, and we're looking forward to hearing your thoughts. So Evan, you want to go first?
Thanks, Josh, and thanks for inviting us. It's always fun to promote work of a bit of a smaller outlet. Just wanted to pick up on something that Svetlana said to start about the universality of this crisis in some forms. And we were a bit lucky, the fact that this crisis hit Russia later than in other places. So Pjotr and I were sort of sitting back and watching as it moved from East Asia to Iran, then Italy, then the United States. And by the time it got to Russia, we had sort of, seen these sort of different trends of the way the crisis develops and the way it overwhelms the healthcare system, the way PPE isn't available in hospitals, the stresses on doctors, and so on and so forth. So we sort of had an idea of, how we were going to attack this story. And for us, this really started in early March, when the first patient got sick with the coronavirus. Well, not the first patient, but the first Russian within the country. And reading over that story today before this talk, it was interesting how the specific themes in that person's treatment, how that's carried along throughout. And one of the unique things I think we've seen with the coronavirus is that it exposes both, positives and negatives in a country or in its response. And so two key things we saw there was the fact that this patient first tested negative twice before actually testing positive. And they were also very poorly quarantined. They were all put in one infectious diseases hospital, all these 6 patients, including this one patient who were suspected to have the coronavirus, and nobody was separated. And there weren't really good practices in terms of how to, keep this really infectious disease from spreading within a hospital, which already by that point we had been seeing in Italy that these would become virus vectors. And I'll get back to that point. And so after that first patient tested positive, we started sort of looking at these different themes. And the first theme was testing. And about 2 weeks into March, maybe a bit, I think it was a bit later, Russia at this point was reporting that it had the lowest ratio of positive tests to testing done in the world. And it was the second lowest was Taiwan, which was 3 times higher. And Taiwan has by far the best response to coronavirus. So it seemed like something was off. And we started digging. And at this point, experts had already started questioning whether Russia's testing was sensitive enough to be picking up all of the positive cases. And this is, again, we'll see as I continue, and then Pjotr will pick up and go from there. This has been something that's plagued Russia in terms of this response. Is it might be conducting lots and lots of tests. It's unclear how many positive cases they are actually picking up. There was also an issue at the beginning, which is quite interesting with the testing, was that there was one single government lab in Novosibirsk out about 3,000 kilometers east of Moscow that was doing all of these tests. And it took Russia a while to figure out that it was a much more efficient way to have different labs set up in Moscow and other cities. So Russia was lagging in terms of the quality of its testing early on, which sort of hampered it, hampered its ability to maintain the spread. However, and it's worth going back to this first patient, what's interesting about the first patient, the first Russian patient who tested positive, was that he had come back from northern Italy, to Russia, where the pandemic had already broken out. And this goes to the authorities' point, and this might, the authorities' point, which they've been making over and over, and this might highlight some of the positives of Russia's response. They closed their border with China really, really early and started limiting flights, and that was able to buy it some time. And so even though there have been blunders along the way, including with testing, it wasn't hit, as I've already mentioned, as early. And so this goes to sort of, this is a positive to the authorities of how quickly they were able to react. And even with some of the blunders that came later, it bought them a bunch of time. So one of these other blunders that we saw, and this was one of the next big stories that we did, was on the remote Komi Republic. And there we saw that what was happening, as for some reason in this really sparsely populated region, which is really massive, it's the size of Germany and Austria taken together, for some reason the virus had spread to all parts of it, and quite quickly, and it wasn't really clear how. And what was happening was that in one hospital in Komi, in Sivtipgard, in the capital, they found coronavirus in one of the hospitals that wasn't meant to be treating it. And so they moved all those patients to the one hospital that was meant to be taking in coronavirus patients, and all the other patients out to the region's main hospital without thinking that they might have come into contact with the virus. Then those patients were all released back to their separate towns and villages around the region. And with the incubation period being 2 to 3 weeks, the virus started spreading that way. And so what we saw was that Russia's medical system became, sort of super spreader of the virus, both in the fact that they weren't quarantining correctly, and as Svetlana mentioned, about the lack of PPE. So we've seen over and over again that Russian medical workers, especially not in Moscow and some of the wealthier parts of the city, do not have enough protective equipment, which means they get infected, and which means they spread it. And this also goes to the point that Regina made about how much medical workers have been affected. They're on the front lines, and compared to other countries, we've seen now in an unofficial toll, they've counted about 170, I believe, medical workers who have died in Russia so far. However, to sort of shift back again to the positives, another thing we started tracking then, and what experts were telling us in March, was that Russia has a really proud history of sort of wartime mobilization when it comes to epidemics, pandemics, disease management. And it really, really, really quickly geared up to open up new hospitals, reprofile hospitals, get beds in place, and bring doctors into this fight. And that, in a sense, even though Russia has the second biggest outbreak right now and second biggest growing outbreak, it has still, because of this, it seems to be the case that it never has reached a tipping point like we've seen in New York or in some of these other places where the healthcare system just collapsed under the weight of this great stress. they were able to, get to a point where they could handle it. What seems to have been the problem, however, is that they've put a lot of these medical workers in more dangerous positions that maybe in some other countries, sort of sacrificing a few for a greater number. I'll let now Pjotr continue with some of our more recent reporting that has gone on from there.
Yes. Yeah, thanks very much for having me here. It's been super interesting to listen to everyone. So as Evan mentioned, Russia's healthcare sort of took pride in its mobilization, but the obvious drawback was that it put a lot of doctors in very dangerous positions. One of the more tragic stories we reported on was the first confirmed death of a doctor in Moscow. He got sick after treating coronavirus patients at a veterans hospital, which was turned into a coronavirus hospital. The staff there, they weren't used to the conditions, the extreme conditions of the coronavirus epidemic. So many got sick very quickly, and one of the doctors died. Another phenomenon we've noticed was that many young students were mobilized to help out in the crisis. So many medical students as young as 20, 21, because for quite a while, Russia was not really investing in its healthcare, or cutting actually its budget over the last 10 years in a policy called optimization. Many nurses were fired over the last decade, and as a result, when the crisis hit, they didn't have the staff to help out, and they had to recruit many medical students. And at first, the students were voluntary, but after a while, as we started talking to them, and new degrees were being pushed in, they were being cursed into basically helping out and serving on the front lines of the coronavirus battle. They were threatened with academic punishments and so on. And I think in that sense, Russia was quite unique, really sort of getting its students on the front line. Another sort of consequence of this sort of Russian mobilization we've seen was the tragic fire this week in the St. Petersburg hospital that we've reported on. One of the ventilators, for the breathing ventilators, caught fire. It was a Russian-made ventilator that was recently built as part of a big contract of almost 7,000 ventilators Russia needed. Previously, it used European ventilators, but now, as the crisis happened, it needed quickly produce Russian ventilators. And as a result, many of them weren't up to the standards needed. Last week, another fire in Moscow killed one patient with the same ventilator. And as we started talking to many of the staff, and some of the staff actually used these ventilators, they started telling us that they were scared of, they felt threatened and scared to use these ventilators. And ironically enough, Russia actually sold some of these to the US for a cheap price last month. But the US luckily said they weren't going to use them. So this brings up us to the current moment where Russia has over 250,000 infections, but a relatively very low death rate, only around 2,500 deaths. And that's really has become the story of the last week. And last week that we've sort of tried to crack and to understand why the death rate has been so low compared to the rest of the world. And from what we sort of seen, the main really reason was the way Russia counted its death. It's a very completely different system of counting compared to European or countries, or the way the US counts its deaths. Russia only considers someone to have died from coronavirus if they could prove that the patient died directly because of the virus. So if they could show that in the lungs there has been changes caused by the coronavirus. And it's actually been relatively open about this fact. And we've seen in some regions, they've been publishing two sets of data. One set that showed the deaths of coronavirus directly, and one that showed a patient died positive coronavirus, but of something else, say cancer. And the differences have been actually 200–300%. We published a story on this last week. This week, the Moscow officials, sort of as a reaction, they sort of admitted that this is what they were doing. And in Moscow, only around 40% of all the death count is registered as part of the official numbers, and around 60 or even more are not included in the numbers. So this sort of might explain why, or this should explain why Russia has a lower death rate. There's been some more reporting coming out this week that also shows that, especially in the regions, even using this methodology, some pathologists have been sort of undercounting or pressured to undercount. So it's, this is another thing where regions don't really want to show that they have a high death rate, scared of the central powers. It becomes almost a competition who can have lower numbers. So on this background of extremely high infection rates and relatively low death rates, Putin came out on Monday to say that it's time to sort of end isolation. It's time to go to work. Many saw this sort of as a surprise, many observers, because it seemed quite counterintuitive. But Russians themselves welcomed this decision. According to a poll, around 80% of Russians they were excited, or not excited, but they were willing to go back to work. And the key really in here is that for many Russians, money was running out. 50% of all Russians only had savings for another month, according to a study today published by Bloomberg. And Putin did not inject a big economic stimulus for small and medium businesses. So for many, this was welcomed. And but for us, for journalists, it will be very interesting to see what this will have, what effect this will have on the crisis, as Russians go back to the streets, as they go back to the metro, as they go back to public places, whether the infection rates go up again, and whether this will further affect the healthcare system. So that's sort of it for now. So just to sum up what we've been doing for the last few weeks with Evan.
Great. Thanks so much, Pjotr and Evan. That's totally fascinating. I'm going to toss it over to Alex to ask the first question.
Yeah, thanks so much. These are great presentations. One thing that's really struck me about some of the analysis emerging from Russia is, some of the parallels, not perfect, but also with the US system, especially the question of the relationship with governors to the center, the question of sort of, comparative sort of benchmarking, the political incentives to underreport vis-a-vis sort of relations with the center and so forth. And so my question actually has to do with a story that appeared in the New York Times about a week ago, May 7th, on the role of oligarchs and business moguls in the COVID response, and how, in essence, they had started supplementing region-wide responses by either direct interventions, within hospitals, buying necessary equipment or setting up charitable funds or so forth. And when I shared this story on social media, I got a little bit of, well-taken sort of pushback. Well, how is that different than Bloomberg and what he's doing in New York, or, the role of Gates or so forth? So I guess I'll ask maybe, Evan or Pjotr, or maybe sort of Svetlana on this, to think about, is this a big meme, this idea of the privatization of Russian public health response and how that links up to oligarchs? Is that something that's playing out? Is it refurbishing their images? And what is the relationship between these private initiatives on the one hand and state and perceptions of sort of state responsibility? So I'd love to hear from Evan and Pjotr on the kind of media coverage of this, then sort of Svetlana on how you see this playing out on the inequality of access issue.
Pjotr, how do you want to handle this? I can go first if you'd like, or if you...
Yeah, you go first, and I'll add anything that comes to mind.
Sure. I mean, it's interesting because I think there's two things to separate specifically with Russia. I can't speak about the United States, but with Russia, it appears to be the fact that if you look at the healthcare system specifically, the private sector has barely played a role at all. We ran a story this week. Our economics correspondent, Jay Cordell, who's also been doing a fantastic job covering this from the business and economic side, that it's essentially negligible how much the private healthcare systems have contributed to this fight. It's pretty much state-run hospitals. But from what I gathered from both that New York Times report and an earlier very good report by Henry Foy in the Financial Times a few weeks before that, is that in the regions, it's essentially the fact that these state corporations, without them, there wouldn't be anything there. So these it's basically like they support what in Russian we call budgetniki. They are workers who live off the state budget, and the state budget is funneled through state corporations. And so to keep the economy sort of humming and to keep from some of this protest mobilization that Regina and others have touched upon from happening, you need these corporations to step up to the plate right now. So I think it's for Russia, at least, it's dividing these two lines, is that the state corporations are sort of keeping the regions afloat. But as far as healthcare goes, it's very much a state-run affair. Private clinics are really much on the sidelines. And it seems to be unfortunate. It seems like they could actually be roped in more than they have. And we've actually seen that with testing as well, where the first test was made by Vector, which is a state-run lab. And that was the only test for about a month until Russia opened it up to private clinics who had already created tests that were potentially, actually, from what we understood in our reporting, more sensitive than the Vector test, and they were selling them abroad because there was demand abroad and Russia wasn't using them. I'll let Pjotr add anything to that, and then Svetlana or whoever.
I obviously agree with what Evan said. Many, as was the case with the economic crisis back in 2008, 2009, back then many oligarchs were asked to step up in a sort of this unwritten contract that when things go bad, we need your help, and when things are going well, you reap the benefits of the economic system. So there's this sort of unspoken contract between Putin and these owners of the big corporations, the non-state ones. But it's also important not to forget that a lot of these business leaders, they themselves will, one way or another, also try to profit from the pandemic. For example, in Moscow, the biggest hospital right now, one of the biggest hospitals, is built by the Galarov family, and they won a big contract without any tenders. So this is sort of a give and take relations that they've been had since the very start of Putinism, I think.
Great. Svetlana?
Yes, so I have, I think, 2 points. The first thing is that the involvement of private capital in the support of vulnerable population is nothing new. It has, for decades, it has worked together. Private capital has been subsidizing nonprofit organizations as well as volunteering initiatives together with the state. And especially after the passage of the law about foreign funding, that non-governmental organizations have to report all the foreign funding, the reliance on private capital increased even more. So this is one thing. So I want to emphasize that it is not new, and that nonprofit organizations have been working with private capital for a very long time. Yet there is a very substantial critique to that, because this charity support versus state-provided support are very different things structurally, because charity support positions the recipient always in this kind of subordinate position, dependency on whether the funds run out, whether the donor wants to continue this funding, and there is no power actually on the part of the recipient on control. On how to kind of spend this funds, and kind of what I've seen so far is that nonprofits have to really develop their ways of how to kind of navigate kind of the allocated budgets and spend them on items that they really need. if this needs were fulfilled at the level of the state, or if there was a system where citizens would be entitled to apply for support and receive this support on the basis of their membership and on their citizenship, it would be a completely different story, because there wouldn't be kind of such a temporal dependence on the reception of these funds. There would be kind of a guaranteed protection by the state, regardless of the fact of the condition of the willingness of the private capital to be channeled toward these organizations. And as well as the presence of non-governmental organizations is another factor here, because they also mediate the distribution of these funds if we're talking about the charity structure. So there has been a lot of problem associated with the charity structure. And in particular, I work with people with disabilities, and charity organizations regarding people with disabilities have received substantial critique, because they, again, configure people with disabilities as these helpless recipients of help, of resources, without providing them any chance to actually demonstrate that they're active creators of content, of values, of different other resources. So it's a very kind of problematic arrangement to depend on private capital in support of various vulnerable populations. But I think that in general, this kind of situation invites us to rethink the relationship of obligation between citizens, state, and private business and private capital. And what could be the mechanisms of resilience that would kind of actually linger on after the end of this pandemic, what ways work and what ways do not work. And what place the state has actually played in the life of people, of vulnerable populations, or just regular citizens. And just my last comment, in anthropology, there has been work on kind of the experienced absence of the state in the lives of many Russian citizens, which triggers this imperative to cultivate networks, cultivate kind of connections and individual what anthropologist Alexei Yurchak calls personalized public sphere, where you don't just go and rely on existing structures, because your use of them and your access to them is very much mediated by your personal ability to access those structures.
Great. Svetlana, thanks very much. Regina, do you want to weigh in?
Yeah, I just wanted to make the point here that there's also a regional component. So one of the ways that we think about gubernatorial strength is not only their ties to Moscow and Moscow, their central base capital, but also the governor's ability to have forged ties to local business, forged collaboration with local business. And there's huge variation across the regions here that I think is going to matter. It's always mattered, and we kind of took our eye off the ball after the 1990s, but now in the post-pandemic time, it matters more. The extent to which those networks are built and established and strong. And so yeah, I just want to sort of make that point generally.
Okay, thanks so much. I'm going to ask a question, and then you can please continue to ask your questions in the Q&A on the webinar, and we'll start taking questions from the audience after this, but just to give you a little more time, I'll ask one. Pjotr and Evan, I kind of like to hear your response to Regina's original proposition, right? So what do you see as the current temperature of the Russian population in terms of its degree of tolerance for the regime? So in the United States, we're seeing even armed protests around opening up parts of the economy, but high levels of public opinion for continuing to stay shut, with a strong demand for the state to do more. In Russia, you've told us there was strong support for going back to work, and now Putin has announced this pivot. So do you see a situation whereby the Russian population loses patience with the regime over the response to COVID? And if not, why not? And if so, maybe walk us through what you think would sort of have to happen, and before, where we would begin to see sort of widespread levels of dissatisfaction leading to the kind of protests that Regina was talking about in her talk. And then I would be happy to hear, Regina, your response to their assessment, as well as if you or Gulnaz have kind of thoughts about this question as well. But I'm kind of interested in how we get from the theoretical that this could lead to growing dissatisfaction for the many reasons that Regina spoke to, sort of what you're seeing on the ground and where you think this is going.
Should we do the same? You can go first, and I'll.
Sure. I mean, I'm wary of this idea that there's some jump from brewing dissatisfaction to action in Russian society. One of the main things I think that we should point out is that there's been a continual sort of burbling of dissatisfaction for a few years now. And I think what we're seeing right now with the pandemic is the same sort of dissatisfaction. It's dissatisfaction over economics. So real wages have been falling for 5-6 straight years now. The economy has been stagnating. This has all been exacerbated by this pandemic. And yes, we've seen some dissatisfaction. We saw the protests in Vladikavkaz because they've run out of money. And we've seen some minor online creative protests, but really an opposition as such in Russia is quite silent. It's understandable. There's no physical way to really protest. So we'll have to just see once the country opens up what that will look like. But just to remind, I guess just like a reminder to all of us what that dissatisfaction has looked like in recent years, it's not aimed typically at politics, and it's not aimed at the federal center. It's usually, it comes out in sort of these social protests and in a local way. So we, since 2018, we've been following a bunch of these protests. And, last year, some of the main ones were trash protests in the north. There was a church in Yekaterinburg that people didn't want built. There were, I'm forgetting some of the more interesting ones, but these were not, it's not, let's come out to protest against the Kremlin and Putin himself. And even the summer protests last summer in Moscow, they were ostensibly about local elections. They were about Moscow City Hall. They sort of, gained some steam and looked to be bigger, looked to be more against the quote unquote regime. But as Pjotr already mentioned, 80%, this is a state-run poll, we should note that caveat, but 80% of people supported Putin's move to go back to work. And Navalny, the main opposition critic, he's collected something like 900,000 signatures or 950,000 signatures on his demand for people to get bigger payouts, which we haven't really seen in Russia compared to other countries. But again, when you talk to experts about Navalny's plan, he has a pretty big anti-rating, as they call it in Russia, and who wouldn't support handouts? Who wouldn't support money when there's no money, no matter the name, who this is coming from? So I think I personally am there. I definitely agree that there's brewing dissatisfaction. We've seen that, and ratings are dropping already for 3 straight years from Putin to the whole government, and it's being exacerbated, and a huge economic crisis would exacerbate that. But I think it's something to watch, and the dissatisfaction we've seen so far in Vladikavkaz or at some of these online protests are very, very minimal from my experience reporting on Russia for the past 3 years. I'll let Pjotr pick up on that.
Sorry, it got very dark in here. So the sun set. I didn't have time to put on the light. No, I agree. It's very important to note that the coronavirus crisis did not give Putin the boost that other leaders may have gotten in Europe. Merkel, for example, or Rutte in Holland is a good example there as well. Putin's rating it's at a historic low, both his trust and his approval rating. So what, in my opinion, will be very interesting to see, and it will be hard for the Kremlin to do, is to get people excited to vote for his constitutional amendment for the referendum. I think they'll have to come up with some sort of trick to get people to come and vote, because at this point it's quite hard to persuade people to let you stay on as a president for another 16 years when the economy is at such a low point. And another very important milestone will be the upcoming Duma elections. So I think this is the background of this discontent will be important, play a big part of it. But so far, polls still show that the majority of Russians are not willing to go out on the street. Summer protests have shown that there are real consequences to going out on the street. Many protesters got jailed. For many Muscovites, that also felt like a moment that it could have gone either way, but numbers never really increased more than 60,000. That was the biggest protest. So I think for a variety of reasons, I'm not expecting mass protests yet.
Great. Let me go to the audience. Question from YouTube from Rosa Hinman, who's an MA student at the University of Glasgow. Would anyone be able to speak about the role and actions of the Russian Orthodox Church in this crisis? In your view, are clergy members reinforcing the state's positions and actions, or are they more split? How about this dimension and what you're seeing? Regina, do you want to comment on this?
Yeah, so I've been really lucky to be in dialogue with John Burgess, who's a theologian, but also a scholar of Russian Orthodoxy during this crisis. And we've been tracking what is really a very significant split within the church. So, and the split is manifesting, or a series of splits, right? It's manifesting in different ways. So there has always been a sort of more liberal communitarian part of the church that wants to do social and charitable work, and then the mainstream part of the church that is concerned with reclaiming land and rebuilding property and so forth and so on. So that split is being exacerbated here. We also see interesting coalitions where opposition to the patriarch is joining or joined early on around Easter with governors who wanted to keep churches open. So we saw the patriarch came out and said, you know, best to stay closed. The several more conservative priests said that's impossible in the Easter season and collaborated with governors to keep churches open. Now we see the church as a vector. Now we actually see the church as a vector. And we have seen some really interesting and very sad appeals about the disease infecting monasteries, infecting parishes, and affecting local clergy. So I think the church is a really interesting example of how institutions we normally think of as being very unified and focused in one direction, that the virus is exploiting existing division and highlighting existing divisions.
Great. Thanks so much, Regina. I'm going to combine two of the questions that have come in that are related on the Zoom channel. The first is from Brian Taylor, who writes, I would like to hear more about how the optimization of healthcare in recent years, including closing of clinics and hospitals, will affect the ability of regional healthcare systems to cope with COVID cases as the pandemic likely spreads more broadly in Russia. Relatedly, what options exist for governors to support healthcare at the regional level, given that most regions are dependent on the center for financing? And then Judy Twig asks, how do the panelists see this crisis affecting the Russian healthcare system post-pandemic? What are the possibilities for reversing the optimization, allocating resources more effectively, overall increased investment priority for the health sector? Gulnaz, do you want to take the first crack at that? But then we're open to hearing anyone who's got thoughts on this.
Yes, I think Russia's health care system found itself in this situation where a lot of, especially lower level hospitals, were taken out or just removed or merged, with the number of doctors going down, with the number of the support staff going down, and moving cases from nurses to what is called like support sanitarki, etc., etc. And this is the case where you need exactly the lower level care to a much greater degree, while a lot of investments in healthcare went into high-tech medical services, you know, surgeries, heart surgeries, and things like that. So in some ways, there has been this unfortunate moment where the priorities for the Ministry of Health didn't quite match the necessity which the health care system faces now. I think the compensation came in the richer regions. As you know, in Moscow, they have built additional facilities. They had the resources to do that, to build new hospitals, to put new beds in VDNH, in big spaces. The other very important player in this game is MCS, the Ministry for Emergency Situations, how do you translate it? But they have come in building mobile hospitals in Murmansk, in various other places in Saha. So they have helped out. But otherwise, the signals that come from the government is that the governors need to prepare those additional beds, and that the government would help with money. But we also know that getting money where it's needed at the moment, the disbursement of the money has been a problem, especially with regard to the population. But I would expect similar issues within the regional and federal budgets as well. So it has been on the shoulders of the governors to increase the bed spaces and to mobilize all the resources they have. There is just one additional little case. So for example, the governors had to buy, if they don't have enough of the ventilation equipment. And there is a visible case, because it was criticized openly in the press, in Vladimir region, where the governor bought, the regional government bought these equipment which was outdated by like 10-15 years old equipment or so. And so there are emerging cases of potential corruption. So things come up like that. But governors are in some ways on their own, except for situations like the outbreak in Murmansk, where it's linked to a big construction site by Novatek, or the Gazprom related facilities in Saha on Chayandina. Those big cases with like 10,000 workers working in one spot on the construction, those cases do attract federal attention, and MCS comes to help with building those mobile hospitals.
I could just really quickly add, before I guess somebody else can jump in, but to Judy's point about optimization, what's been interesting to see since the pandemic broke out was that some people close to the state have criticized that process, and it's seen sort of as a Western, it was a Western idea to trim down this bloated Soviet system, and now some people are looking back on it and thinking, maybe we were right all along, and part of the reason that, if we trimmed it down even further, if optimization had gone to its complete end, we wouldn't actually have handled the pandemic as well, having at least some extra beds in places like Moscow that they might have not had. So I can't make any predictions, but I think I'm going to be watching that as keenly as you probably are, Judy. On to somebody else.
I guess I want just to make a brief comment about the kind of, although the question was about the healthcare system in particular, I would like to bring our attention to the fact that there are a lot of collateral effects that are unrelated directly to the healthcare medical care. And that is sometimes placed within the domain of social support or social kind of rehabilitation services and social security. I know that interestingly, there has been a bit of enthusiasm associated with the fact that in the movement, especially about to shut down psychiatric homes in Russia, it has been a very kind of long battle about kind of whether they should exist, what kind of support should be provided within them, or whether we should opt out for more like a community-based support. And the fact that some people with complex disabilities and people with mental disabilities were allowed to leave those institutions and live in private apartments and receive care, which is way more comfortable, way more humane. It is a big sign, and it's a good sign. And many people who work within this domain are hopeful that it could possibly be a beginning of the reformation of this particular area, and to see what kind of changes could be brought about for these people too.
Great. I want to weigh in on a question that was posed by Gulnaz Sharafutdinova from the CPJ, and that gets to media coverage for this. And Pjotr, maybe I'll go to you on this. And that is, Russian Foreign Ministry has made some critical things about the coverage of COVID-19 in Russia. Do you think Russian, in the FT and the New York Times, do you think the Russian authorities might move to expel more foreign journalists, particularly American ones, from Russia in the coming weeks? How sensitive is the Russian government to media coverage of what's going on? And then maybe just to weigh in with Ann Cooper and her question too from earlier, where do you see, some of the innovative, apart from the Moscow Times, of course, but some of the innovative investigative reporting come from some of the outlets like, that were mentioned, like, The Bell, or, these kind of smaller, more nimble sort of media forum, many of them based at Expo, Medusa Project, The Insider. Has this sort of put them on the map, or are they having more difficulty? So maybe just take us through the media landscape.
Yeah, it sounds good. I don't think Russia will walk the Chinese route and expel the Financial Times and New York Times. To me, for context, so last night news came out that Russia asked New York Times and Financial Times to retract their stories about the death rate count. And apparently they're sending it to the New York Times and the Financial Times, this letter that they have to retract it. And some people in the Duma have asked, for them to be punished, and the punishment could even include them losing their license. I don't think that will happen. It seems to me more that the Harriman and a few others are just sort of trying to beat their chest a little bit to show that use it a bit of a propaganda tool. That these Western outlets are lying about what's happening in the country. It's a curious case because much of what is reported in those two pieces is already public. It's been reported by us, by the Moscow Times, but they're also relying on statistics that have been out there in the public. So it's quite hard for Financial Times and the New York Times to retract something that has already been, said by the authorities themselves. And I think Zakharova sort of already walked back a bit this morning about her statement. So I don't think there will be too big of consequences, but the authorities are very sensitive to what is being reported, and they've introduced this fake news law specifically towards coronavirus, and local outlets have been punished for it. A medical outlet was banned for a day for an article that they've written about the crisis, and other Novaya Gazeta, for example, wrote a big piece about what's happening in Chechnya. And they were also censored. They had to take down their article for a while, and they've only put it back up after changing some stuff in it. So it's definitely a sensitive topic, and I think for many, you hear instances of some Russian outlets are self-censoring themselves at the moment because they don't. Another quick example is Novaya Gazeta. They wrote a column about the fact that they had a big story about an outbreak in prisons of coronavirus, but they couldn't publish it because they were worried that they would get in trouble for it under this fake news law. Regarding the Russian landscape, there's been a lot of smaller, very good outlets popping up. You've mentioned The Bell, you've mentioned Project. I'd like to mention a new one. It's called Важные истории, if I'm correct. Important stories, if you translate it into English. I think they're all, contributing well. They're making a name for themselves. Project especially had a few very interesting investigations. As we've seen lately with Vedomosti, the bigger outlets have trouble to operate successfully and freely in Russia. So now it seems that they're slowly splitting up into the smaller ones, and they're the ones that are doing the more investigative stuff, because the big ones just aren't allowed to anymore. So yes, I do think they're making a name for themselves during this crisis.
Great, thanks. I just very quickly add from the chat that Rachel Denver noted that early on Maria Zakharova took Human Rights Watch to task for what they thought was a mild statement about COVID and pretrial detention.
Yeah, there's been many cases. I haven't been able to mention all of them. So yes, they're reading everything, and they're very sensitive to it.
So I want to try to I'm going to try to combine a couple of the questions that I think are related. So we have one from Elise Giuliano, which asks, much of the discussion here about the state response and state shortcomings seems to assume that Russian citizens take the pandemic seriously. How accurate is this assumption? Are people afraid? Are they open to accurate information about coronavirus and taking it seriously? We know this is not the case in many parts of the US. Maybe this varies by region, especially since some regions are less affected by others. And then related, in a sort of tangential, in a sort of potentially related way, I'll put it at least, but it's super also interesting, is from Catherine Stoner, who asks, why do you think Putin isn't using more of the federal nest egg to support small and medium businesses? Is this a state capacity issue? Or to link it back, I'll link it back to Elise's question, is it because he's making a calculated gamble that actually people are not that concerned about Corona, and so this money is better saved for future uses? So interested in responses to either of those questions, and I'll open it up to anyone.
Happy to talk about that from on the ground. There's been a big information vacuum from the top about like how dangerous this virus actually is. There's no like single sheet of paper that you can find with clear instructions. And part of the past 6 weeks to lockdown, it partly worked simply because nobody wants to go get a digital pass from the government website, and people don't want to walk outside and get arrested. But it sort of eased up as people realized that it wasn't so strict. But when you go to a store, when you are walking around outside, up until masks were mandated in Moscow this week, we barely saw them in stores. People weren't really social distancing, and I think that people don't really take it that seriously themselves. What has sort of worked to some degree here so far is nudge theory, I guess, if you would call it that, is that, putting certain policies in place kept people off the streets, but it doesn't seem like there's some like hyper aware population that is actively on its own trying to maintain these policies. And that might be why we've seen this spread, even though the country has been in a 6-week lockdown, or technically been in a lockdown, is that people themselves aren't taking it that seriously, and the people enforcing it haven't seemed to have been. I don't know, Pjotr, if you want to.
Yeah, I mean, what you've seen on state TV for the first month and a half at least, a lot of government doctors saying that the virus is not dangerous. I mean, Russia is not unique in this, but it definitely happened in Russia, and where TV plays still a big part and influence. So many doctors, many experts said the virus is not dangerous. There were some almost pseudo-racist things behind it, that it can only affect Chinese. It won't get to Russia. For a while, Putin himself said everything is controlled, don't worry about it. It can only affect the older population. There was sort of a thought that was there for a while. So I think because of that, and then suddenly you see a 180-degree flip in the way state TV started to report about the virus. And once Sabanian and one other official started realizing that it is dangerous and that it is affecting the Moscow population very quickly. So I think that played a big part in it. If I could quickly semi-answer the second question, if that's okay. Why Russia hasn't spent more money on the small and medium businesses? I think the second part of your answer was one of the reasons. They do think that it's better to keep this fund for the years ahead. But to me, another part of it is it's almost an ideological perspective. For Putin, the small and medium businesses isn't the core of his support in his mind. There's this fascinating interview he gave this year, I think to State TV, where they asked him about his thoughts about the small and medium businesses, and he said that part of him still considers them thieves and sort of I forgot the exact word he used, but he has this sort of 90s mentality towards smaller businesses. They're all just trying to make money. That they're all just sort of anyways, you get what I mean. So sort of there's this idea that for him it's the people that work for the state corporations. Those are the backbone of his support, and not the small and medium businesses, so he doesn't need to support them.
Regina or Gulnaz, would you like to jump in on Catherine's question?
Yes, so I want to first point out that we do see some difference coming up. So from the beginning, for sure, the state reacted as it reacted to earlier 2008 crisis with focusing on systemic enterprises, system building firms, companies, etc., and giving support to those. And I think Pjotr is right to point out the political side of it. But I think the noise over the big hurt to small and medium and micro businesses has been growing. And already, if I understand correctly, on May 11th, with these new decisions that Putin came up, already certain things are being done. To my understanding, all the self-employed people have the right to claim whatever taxes they paid for 2019. So I think there is some awareness. It doesn't mean that a lot of money will be given out, but the government is trying, both on the national level and definitely on regional level. I pointed out that, you know, they have different capacities, and in some regions they are much more willing to provide some degree of support to arrange some type of chains of demand for the services of smaller businesses to keep them afloat. And I think the other decision was made that the small businesses will get subsidies, credits for paying salaries that they don't have to return if they're able to keep 90% of employment going. So I want to point out that this very early sense that, you know, no attention whatsoever, it is changing. Things are quite dynamic, and the Kremlin is reacting to approval ratings and understands that part of the approval ratings is linked to the fact that I think Zubarevich talked about 25 to 27 million people in these small businesses and private entrepreneurs who haven't gotten help. And it's a big chunk of people who work in Russia. So the government will have to somehow open their eyes. And I think it's starting to do that. So I just wanted to add this complication to the story.
Thanks, Gulnaz. We'll take just two more questions here. One, a version from of Cornelia Evans is asking a question about contact tracing and plans for reopening. Will this happen at the national or regional level? Will there be state funding and training for it? And how do the panelists feel about public compliance with tracking and tracing, which is so important for maintaining public health? So I'll throw that out for whoever wants it.
So let me make a very small point in relation to that and then pass it off to someone else.
Great.
Levada had a very interesting poll early in here. I'll tie it to the previous question, where it shows that the country's really split on how seriously they're taking the virus. But they're not split on how seriously they feel the economic pain. So that's an interesting division in opinion. The other really interesting thing is they asked folks what they feared most from the virus. And in first place was the sickness or health effects for children and young people. In the second place, it was world war and international conflict. And in the third place was the aggression of the state and state presence in everyday lives. Now, these are kind of small numbers, and I don't know how far to take it, but I think this this idea of being monitored and traced is having some resonance within the population.
Great. And I just want to also ask Rachel Denver's question about stigmatization, and I'll direct that one to Svetlana. Svetlana, do we see ongoing stigmatization in Russian society or neighbors or people with COVID? Is this an issue? How has, how have these perceptions evolved as a result of media coverage over the last few weeks?
What I've come across in my, as I have been tracking the, what has been happening with different marginalized group, is that stigmatization has been particularly strong, relating those people who are deemed not worthy of social support. And here, what is kind of the question of responsibility surfaces as this kind of the moral marker that decides whether people go and volunteer to provide their support, whether they donate money to a charity cause, or whether they kind of advocate on behalf of these groups. And especially, I would not comment on the kind of the ethnic division lines, because I just haven't come across any information regarding this. But regarding people with addiction or HIV positive people, there is a very strong stigma that often places the responsibility onto people themselves for the condition in which they find themselves. It also applies to homeless population, and it kind of ties to the fact that there are so few organizations, in fact, who actually manage to deliver support to these people during the pandemic and also during just ordinary times. And it is very important to think about these populations and kind of this, the reproduction of stigma, because there are a lot of collateral effects, as I've been trying to communicate, besides just the kind of the direct effect of the virus on individual bodies. And one of them would be among the homeless population, for example. There have been documented cases when the police would stop volunteers from distributing food to the homeless population, or there have been cases of weaker kind of organizing to support people with addiction, or people who are getting released from detention centers. So the unequal distribution, it is, I can see it very clearly, the unequal distribution of attention and support that has been channeled to certain groups as opposed to others. And just to reiterate, I think it does happen along the kind of these moralizing lines about who is responsible for their condition and who is just kind of being thrown there.
Very interesting. Thanks, Svetlana. And Josh, you have the final question.
Yeah, so yeah, we're coming to the end of our time here. I want to thank all the panelists for all of their time. I want to thank the audience for being here. But I do, we titled this panel "Russia in the Time of COVID-19," and I feel like since we're lucky enough to have Evan and Pjotr here with us today, we'd be remiss if we didn't have like end with one question on what it's like to be a reporter in Russia in the time of COVID-19. Like, are you doing reporting, via Zoom? Are you out trying to find sources? What's it like? There's a whole set of challenges to reporting in Russia, period, writing for, for an English language publication. How have you found the situation for journalists generally, but in particular, your little corner of journalism writing for an English language newspaper? How are you finding that being affected by COVID-19?
I can start, Evan, and then you join in later. I think what is very obviously, we stay home as much as possible. We do most of our reporting through different Russian social media mostly. What is very interesting when you report on a story is the fear many have when speaking out, whether it's medics, whether it's doctors, professionals. A lot of them want to tell the story, but they're also very scared of the consequences. So unfortunately, many of our stories feature anonymous sources because they're very scared of the consequences of speaking out. And then sometimes when you read a story in Western media and you read a critical story of the government and you see the names of the people, you get surprised and you remember that in places people can speak out and want to speak out freely. For example, we're doing a story on prisons where prisoners spoke to us. We spoke to 6-7 prisoners about the conditions within the prison, and they were all very scared to speak out because there would be severe consequences. At the same time, media in America did the same stories, but with prisoners on the record because they knew they were in the right to speak out. That's sort of a quick take from me, Evan.
And when you say, just one quick follow-up, when you say you're finding people on social media, is that VKontakte? Is it Odnoklassniki? Like, what social media are you using for that?
It also very much depends on what the story is. VKontakte is a good source, Odnoklassniki, Instagram. Those are sort of, I'd say, the Facebook as well. Russians are very active on social media.
Evan?
Yeah, I'll just say that, yeah, there's a fear of sort of going public with speaking, but one myth, I think, is access in Russia. And we found that if you go out looking for people are willing to talk. Of course, you want to talk to them over a channel to keep them safe, and you want to make sure you don't have too many identifying details if they don't want to be identified. But people chat. I mean, in most of our stories, even though we're sourcing them anonymously, you'll see we usually minimum half dozen to make sure that we've gained enough of a reader's trust that this isn't just one random guy who's talking to us. And we try to verify as best as we can that these people aren't making something up, because we can't see them face to face. So we'll try to verify the information they give us in another way. But I mean, we've been putting out stories quite constantly this whole time. And if you look at the sourcing for it, there's people talk to us, medics talk to prisoners, like Pjotr mentioned, and so on, and including government officials. We've had a deputy from the ruling party talk to us about how testing hasn't been as good as they want it to be. So I think there's sometimes a myth about reporting on Russia as a Westerner, that it's all closed off. I think that's not the case, and I think that's partly due to laziness. The other thing I'll quickly say is that Pjotr illustrated some of the dangers that Russian journalists face, having to self-censor because of what might happen. Foreign journalists don't face any of sort of those problems at all in Russia. We're in a really unique position. This current controversy with the Foreign Ministry and New York Times and the Financial Times, I agree with Pjotr wholeheartedly that I think they're sort of just puffing out their chests right now. But they're really not going to follow through. I mean, it could be proven wrong. I just don't see it happening. And so working for the Moscow Times right now, it feels like a great, both important a responsibility and a privilege, because we've gotten to tell some stories that maybe Russian media has shirked away from, and that have then been picked up in the Russian press. The prison story is probably the best example, because Novaya Gazeta, the country's most prominent investigative newspaper, decided that they wouldn't write anything about it, even though they had the same information we had. So, in a journalistic sense, we were beaten to that story, but just because we're a foreign outlet, we were able to tell that story first. And so I think we both feel a responsibility to keep telling the stories that we can, and to telling them fully well, because of the current situation. And then on a personal level, journalism is keeping us sane, because it's good to keep working, and it's a good way to keep busy. On that note.
Great. I think we're at time, so I've got to put an end to this discussion and draw it to a close. Thank you so much, panelists. Thank you, Gulnaz. Thank you, Regina. Thank you, Svetlana. Thank you, Evan and Pjotr, for taking the time out of your very busy days. We'll continue to follow you. And thank you to always my partner, Josh Tucker, as well as all the people behind the scenes at NYU and at Columbia, at the Jordan Center and the Harriman Institute that make this possible. And just a reminder to you, our next session will be on Russia in Africa in June 18th. We'll have a confirmed lineup for you next week. We'll do another one of these sessions and keep checking for these events on both of our websites. So thanks again for joining us. Stay safe, stay healthy. And after we cut the feed, I'll ask the panelists just to stay for a minute or so. Bye, everyone.